Kim, it's really interesting that we're having this conversation today because just about an hour before we started, this survey came across my desk, and it's from Angus Reid, and it says 7 in 10 Canadians believe the anti-vaccine movement will lead to unnecessary illness and suffering, which is a good thing. 7 in 10 is good. We're still high numbers there, but there are really stark differences in vaccine acceptance across provinces and most alarmingly to me, political ideologies. So, for instance, Alberta is seeing whooping cough outbreaks. Quebec has the highest percentage of anti vaxxers. And in general, conservatives are more than 5 times more likely to be anti vax than liberal. Does this surprise you at all?
Not particularly. One of the hallmarks of conservative thought is that there is a level of distrust for people who are not like you. So if people feel like they're not connected with their politicians, if they feel that they're not connected with their healthcare providers, there's a baseline level of distrust that we can demonstrate in trials that makes people less likely to access this kind of care.
So I think given everything that's happening in the world right now, particularly to the south of us, where we may see some massive changes in vaccination, this is a really timely discussion. And I want to start with the basics of how vaccines work, how they work in the body and why they are so effective at preventing disease. So maybe you could start there for us.
Sure. So every time you leave the house, every time you walk around in your house, you're bombarded through your nose and your mouth with all sorts of different proteins. So the proteins from your cat's hair, and the proteins from your dog's saliva, and the proteins from the vegetables that you just rinsed under the sink. So we're always being surrounded by this little cloud of antigens, which is the name for the kind of proteins that we're exposed to. Most of these proteins are totally benign, and a certain percentage of these proteins can cause harm, and we call those pathogens. So, back in the old days, you couldn't develop immunity to something unless you'd been already exposed to that antigen. So, unless you'd had the illness before, like the common cold, right? We don't have a vaccine for the common cold, but when you send your kid to daycare for the first time, they get sick from every common cold virus that's floating around. They've never been exposed to that pathogen before, so they fall ill. Okay. So vaccines are just a way to make sure everyone gets the antigens, the proteins from the dangerous viruses so that our bodies can be prepared to meet them and get rid of them before they wreak havoc in our bodies.
It's interesting you said that about the common cold. I remember when my kids were younger in school, like the first couple of weeks, they'd always come home, they're little germ carriers, I would say, and everybody would be sick in the house. But there were always sort of these moms too who were like, oh, well, let's have a chickenpox party, which just always boggled my mind that they would expose their kids. So how do you say to, because there are people who think, well, we should be exposed to these things because then we're healthier.
Well, as we know from COVID, so COVID is a really complex immunological disease. But as we know from COVID, the dose of antigen that you got, the amount of COVID you were exposed to, played a role in whether you got sick and how sick you got. So ideally, we're going to give you such a tiny dose that your body's not going to get that sick, right? That you're not going to have a massive protein antigen exposure that's going to make you really sick. So for chickenpox, most of the time, chickenpox makes you uncomfortable but doesn't kill you. But sometimes it does kill you. So
Right.
ideally, we're going to give you a tiny dose of chickenpox through vaccination so that you're now not going to be exposed to a massive load of virus without the capacity to respond.
And I think this leads to my next question, actually, because I think we have to clarify a little bit because you said give you a tiny dose of chickenpox. Because there's a lot of people who say I got sick after I got the flu vaccine. I got the flu after I got the flu vaccine. So can you maybe explain that phenomena a little bit?
Sure. So for the vast majority of the vaccines that we have, we don't actually use the part of the virus that makes you sick. So viruses kind of look like little bugs. And so we'll use in the vaccine, we'll use a little chunk from the bug's arm, but it's the bug's torso that makes you sick. right? Because when the bug comes in, your body's going to see the arm and be like, yes, I know you. I'm going to get rid of you. So that piece, the non-infectious piece, is enough for your body to get rid of the pathogen. But when people are talking about the flu vaccine gave me the flu, it's impossible. The infectious part of the flu isn't in that vaccine. There are rare vaccinations that there are. So there's certain vaccines, especially for travel vaccines. Some of them actually are live vaccines, and we have to be more cautious about who we give those to because they actually can cause trouble for people. But for the vast majority of the normal vaccinations that you get at your doctor's office or at the pharmacy, it's just impossible. But as people, as human people, we're always searching for explanations and patterns, right? So if you happen to go out and touch the pump at the gas pump and be exposed to a cold virus and you had your vaccine 2 days earlier, people interpret that as vaccine caused the problem. I'll let you know too, flu is relatively rare. I've had flu probably once in my life. I could not get off the couch for a week, right? Like it's real bad disease. When you get it, you know. So the average kind of my nose is running and feeling a little tired, I'm coughing, probably not influenza for most people. So they're getting cold viruses and attributing it to the shot that they got because that's how the human mind works. We're always trying to figure out how to avoid danger. So we look for these patterns.
Yeah, I had I'm just gonna say I had the flu once as well, and it knocked me out for almost a month. I was so sick and I never, ever, ever want it again. So I diligently get my flu shot every year.
That's right. I tell people that if you've ever actually had flu, you will never miss a vaccination.
Honestly, and it's not because I'm afraid of dying necessarily, but who wants to be knocked out for 4 weeks? And that is potentially how long it can be. It's awful. So let's talk a little bit about what the world looked like though before vaccines.
Sure. So one of the things that got me interested in vaccines was I happen to have a child who's a morbid child. I think it might be because both of his parents are physicians. But when he was about 3, he was like, okay, so skeletons are monsters, right? And we're like, yeah, skeletons are monsters. And there's a skeleton inside of me. And I was like, yes. And he was like, and dad fixes skeletons. So his special interest became the undead. So I spent a lot of time in my child's early years in cemeteries. And I challenge you to visit the old-timey cemetery in your city or
Mm,
town, and look at how many of those gravestones are tiny gravestones with little lambs. They often have a little carved lamb on top of them with death dates at less than 1 year, right? In early days, childhood mortality was 1 in 10, right? And this is the reality of the situation. And about half of that mortality is due to other things like insulin for diabetes and antibiotics and good sanitation, right? Those things all play a role in that decrease in child mortality. But the other half is vaccine preventable diseases, things like pertussis or whooping cough, which kills even now 1 in 200 kids that contact it. And for those that don't die, it's called the 100-day cough because it is disabling and those kids end up in hospital. Hospitalization rates right now are about 1 in 15 kids with pertussis with whooping cough will end up in hospital. It's not a benign disease.
and is that because of they're not vaccinated, or is that because some of them are vaccinated and they still get it? Like where does that sit with this? Because I know, like for example, you can still get COVID if you get the COVID shot, but it's not as severe.
Yeah, so pertussis outbreaks, whooping cough outbreaks, tend to happen in unvaccinated populations. However, again, it's exposure related. So if you've gotten a really high dose, you can still have a mild case even as a vaccinated person.
So are there any real world situations sort of in recent history where vaccine decline has shown just how impactful vaccinations can be? If they're not getting them, what happens?
Yeah, there are a couple of situations, and it can happen really fast. We can see these effects really, really quickly. So you may have heard in the news there's been a fair bit of controversy about the election of or the appointment of RFK in healthcare in the States because his charity, one of his anti-vaccine charities, did kind of a publicity tour through a small country called Samoa. And it's a little island state. They've got about the same population as Sudbury, Ontario. And in the years before that charity was active there, about 75% of their kids were vaccinated for common childhood vaccines. And in the year after, that number dropped to 30%. So you had a population where about 30% of kids were vaccinated, young children, kind of, in those first 3 to 5 years when kids get most of their vaccines. And a year later, so a year and a half after this charity was there, charity, I say in quotes, this anti-vaccination campaign was run there, they had a massive outbreak where 83 children died in a population the size of Sudbury. It was probably spread by one infected tourist who flew through their air, right? So within
Wow.
2 years of a drop in vaccination, we saw massive mortality. And about 70 of those children were under the age of 1. So this is our smallest, most vulnerable, who are most affected because they had not been vaccinated.
And since that time, have things changed? Like, is their vaccination rates back up again?
Yeah, so there was a massive public health campaign on the island that vaccinated more than 80% of kids in the months following. They had to close down schools. It was a huge undertaking to try and protect the rest of their children.
And I'm going to assume that this charity claims no responsibility for this at all.
Of course.
Of course.
And then we can look at other places. So in Sudan, for example, there's really significant geopolitical conflict there. There's been a lot of displacement. People are having to leave their homes. And there's been a real dissolution of the medical system there. People just can't access care. They have a childhood mortality right now of 4 in 100. So out of every 100 children born, 4 of them will die before their first birthday. And about a quarter of those kids die from tetanus, right? Their moms are
Wow.
not being vaccinated appropriately, and they aren't able to give the antibody to the child in pregnancy. The child is born out of hospital in a place where the umbilical cord is being cut using unsanitary methods, and a significant proportion of their childhood mortality is from tetanus.
So I have to say, like, I don't know what that means in terms of what does that look like to actually die from tetanus?
So the common term for tetanus, just like pertussis is the 100-day cough, tetanus is called lockjaw. And the children end up in enormous muscle spasms that suffocate them. They can't expand their lungs to breathe.
Wow, that's horrific. And I think most people don't understand what these. I mean, certainly I don't. I know I'm vaccinated against it, but I don't know what it would look like to actually get it and die from it. So I think that's something I think we need to be sharing a lot more, because we say these words and we throw them around and people don't understand what it actually means to have this disease or this virus. So that's huge. So thank you. So when I was researching this, I came across an article from the NIH that mentions something that was intriguing to me. It suggested that the roots of vaccine skepticism lie in a wider distrust in public and state institutions, which in some cases traces back to experiences under Soviet communism. I found that really interesting because we know obviously now just how much Russia has been feeding into the internet and feeding this disinformation to us. Do you have any thoughts on how we combat this entrenched distrust and work to restore confidence in vaccines and public health initiatives?
Sure. That's something that I deal with fairly frequently as a clinician because the bulk of my work is in prevention and treatment of HPV disease, which is a vaccine preventable disease. If we had higher vaccination rates for HPV, my job would disappear. So I am really hoping that we have better vaccine coverage soon because I would like to retire eventually. That's definitely in my plan. So I have these conversations regularly with patients about HPV vaccination, and I certainly do come across hesitancy, and it's often based in distrust. And in Canada, we are blessed to have Medicare. We're blessed to have a public health system. So you can imagine if we were giving a vaccine that caused health problems, it
Mm-hmm.
would cost our healthcare system so much more money. So why would we give people free vaccines, pay for all the vaccines, and then have more healthcare problems and have to pay more for the complications of the vaccine? Right? The
Right.
very fact that the government is like, hey, we're going to give you this thing for free, we're going to give it to you because it's good for you, is a statement that it saves healthcare dollars. And if you're saving healthcare dollars, it's because your population is healthier.
Perfect explanation. So obviously, you mentioned RFK and, his potential role in the US coming up. And we're seeing, sort of Alberta's recently limited vaccine availability. Aside from voting, what can the general public do to address and sort of counteract these harmful policies in the meantime? Because they are impacting us in real time. And I just don't know aside from getting updated vaccines and voting, what else can we do?
I think it's important to make sure that you're having conversations with your friends and family, that you're just mentioning, hey, I went and got my vaccine today. Don't forget to get your flu shot. Here's the link to the pharmacy in our neighborhood that's giving it. Just make it as easy as possible for you and your family and your kids to be reminded that it's important to do. In our current healthcare environment, we don't really, most people aren't at their family doctor's offices regularly to be reminded. So we actually do have to offer some level of support to each other to make sure that we remember that it's time. You can download the apps. There's the Canvax app that helps sends you a little notification when you're due for things to make sure that you show up. And then another piece is just making sure that you talk to your member of parliament about supporting primary care. The primary care environment is where people have best access, ideally, to vaccination. When the person who's talking to you about vaccination is the person who's known you since you were a kid and whose advice you understand and trust, right? So, yeah, talk to your MP about increasing resources for public health. Ideally, your doc would have a nurse practitioner who could come around with a box full of vaccines and run a vaccine clinic for them one day to take the load off them. And all of these resources should be available to our primary care team. So making sure that your politicians know that that's important is just one more kind of systemic piece of making sure that this is accessible to people.
Actually, you brought up something. Recently I read 6 million Canadians do not have a family doctor. And when you don't have a family doctor, that means you're relying on clinics and hospitals. And it can sort of, nobody's really keeping a running record of your health, it would seem. It's sort of up to you to advocate and keep track of this for yourself. So when it comes to vaccinations, where do people access those? And how do you suggest they keep them up to date in their own records so that they can carry them with them?
Yeah, so, back in the old days, we all got our yellow vaccine card.
Right.
You can keep using that yellow vaccine card forever. And I certainly do have my older patients who show up with their little envelope with all of their pieces of paper in them. As I mentioned earlier, there are apps available for folks who are more tech savvy where you can keep everything updated and it'll send you reminders when things are due. And in some places, you can access through your local public health unit. A lot of people don't know this. Like when I'm talking to people about HPV vaccine, they're supposed to get it in grade 7, right? So I'm like, did you get it in grade 7? And they're like, I don't. But if you go onto your public health, your local public health unit, they often have those records available. So you can actually either call in or access through their website the records of what vaccinations you got through public health. It may not cover vaccines that you got through the family doctor or through the hospital, but at least it'll give you some idea of where you're at. You can
Okay.
call your pharmacist too, right? I have patients who
Right.
are like, I don't remember if I got my shot. Call your pharmacist. If they dispense the shot to you, either by putting in your arm or giving it to you to take to your family doc, they're going to have a record of that as
Can there be harm caused, though? Say you can't find a record of it and you just want to make sure. Can you be
well. Yeah,
over vaccinated?
for most vaccines, it's fine. Again, we're exposed to antigens over and over and over again through our life, and we're not giving you the whole pathogen. We're just giving you that little antigenic chunk. If you've been vaccinated before, you might have a bit more. The side effects of vaccines are actually your body's immune response mobilizing to deal with the pathogen. So the sore arm that you get is not because the stuff in the shot makes your arm sore. It's because your body's running, all of your little immune cells are running to that spot where the antigen, the pathogen, was introduced to help form the memory T cells that are going to give you long-acting response to these vaccines. So you may have a little bit more of a sore arm because your body's already seen that before. It's already got those memory cells formed. It's already like ready to rock. So you may notice a little bit more arm stiffness or a little bit more kind of achiness or all of those kind of systemic immune system response symptoms.
Something we talk about a lot when we talk about vaccines is herd immunity. And I understand that, if vaccines, if people stop getting vaccines as much, we will lose that herd immunity. And people who don't have the vaccine will obviously get sick and it will spread to the community. But what about the people who did get their vaccine? Will they still get sick? What does that look like for them?
So that's really on a case-by-case basis in terms of how different diseases act and how different vaccinations act. And we've seen this play out recently. Some vaccines, like HPV vaccine, is so effective. You get it once, you're like close to 100%. You're 99.9% protected forever from persistent HPV disease and cancer. It's spectacular. So no matter what's happening in the herd around you, you're going to be fine if you've got that vaccine. But then we have other vaccines like the COVID vaccine or the flu vaccine is a great example where you get partial protection, right? Mortality for Omicron for folks who weren't vaccinated was 10 times higher than for folks who were vaccinated. So, you're still going to get exposed. You may still get sick, but you still got way more protection from serious harm than if you hadn't had the vaccine. So every different disease kind of has a different level of vaccine protection versus susceptibility. Yeah. So there definitely are diseases where that's an issue. Pertussis is one of them. Whooping cough is one of them where we have partial immunity. So if we lose herd immunity, you may still have some symptoms if you're infected.
Is there one that you probably won't be able to maybe pinpoint one, but is there one that sort of scares you as a reemerging?
From a public health standpoint, pertussis is a big one. That's in the developed world, probably the biggest killer in terms of numbers and severity. So pertussis definitely, whooping cough makes me nervous living here where I do. The one that's probably the biggest threat worldwide is measles because it is so infectious. So infectious. You need one person in an airway or airport hall and you're going to get a massive exposure and so it just spreads so quickly and in unprotected populations. Its mortality is lower than pertussis is. It's less likely to kill you, but serious health consequences to it are real and they happen. And when you've got so many people infected so easily, we see those complications come.
I feel like this should be common knowledge, but obviously I think we live in a time where common knowledge is so very uncommon. So where would you recommend people go to find reliable sources on vaccine information?
Sure. So I'll often recommend the Mayo Clinic website. They tend to do a really nice job with patient communication. You can also go to the Government of Canada website. They actually have really detailed information available for all vaccines. So if you go on the website and just search the vaccine that you have questions about, they've got tons and tons of information available publicly there. And then your family doctor would be the other resource.
So we're heading into the holidays, and a lot of people will find themselves at the table with, family members who they may not see eye to eye with on this topic. And it's difficult to have these conversations, especially if you're not armed with some facts. So do you have any sort of recommendations for having these discussions with people who are skeptical or perhaps anti-vaccine? Just sort of real quick points they could just drop into the conversation and not have to worry about it?
So for certain folks, it's not going to be a productive conversation. For some
Right.
people, their health ideas, their health beliefs are really more religious than factual. You could show them all the evidence in the world, but in their heart, they feel it's wrong, so they're going to
Yep.
say it's wrong, right? There really are people for whom all the facts in the world are going to make no difference. So when I'm in a circumstance like that, what I'm saying is actually not for those people. It's for the other people in the room, right?
Right.
Because if you're in a room where all you hear is incorrect facts, incorrect facts, incorrect facts, over time you start to think, well, maybe I'm the one who's wrong. Maybe they're right because everyone else is saying this stuff that I thought was wrong, but maybe I'm the problem. Maybe I shouldn't be. So what I try and do is actually just restate things as factually as I can for the other people in the room, right? So that you're reasserting reality when we're dealing with people who are personality disordered or really kind of steeped in that system of misinformation. You just try and reassert reality for the people around you. So I got my flu shot yesterday. I feel fine. I feel really relieved that I'm protected this season. I don't want to make anyone else sick. We're going to see grandma next week. I made sure that I got my flu shot because, even if there was a tiny chance that I would make her sick, I would really feel bad. So the community connection, reasserting reality, and just talking about it. Like, yep, got my shot. Yep, got my shot.
I love
All
that.
you can do. Yep.
That reminded me, there is many psychological studies, but there is one in particular where they do that, where they have three people who are denying reality and one person who is firmly grounded in reality. And over time, that person is swayed to be like those other people. So such a good reminder for us right now to stay firmly grounded in the reality and the facts of the situation, and not to try to argue with the other people in the room, but to keep everybody else grounded with us. So that's an excellent way to end this interview. I can't thank you enough. You are always sharing on social media. You try to keep people updated, keep us all firmly grounded in reality. So where can people keep up with you?
Sure. I'm on most socials as Dr. Kim Alexander. So you can find me on Blue Sky, you can find me on Threads, you can find me on Instagram, you can find me on Facebook. I'm no longer on the platform formerly known as Twitter, simply because of my concerns over misinformation there. But yeah, come find me, and also on my website, drkimalexander.com. All sorts of healthcare articles archived there. You could sign up for my monthly newsletter. Yeah, and there's tons of resources there, as well as podcasts like this one. The link will be up there.
Amazing. Kim, thank you so much for joining me today.
Thanks for having me, Candace.